Vision is such an essential part of our lives. So much of what we do and enjoy depends upon the ability to see clearly. If your vision begins to fail, it can cause great anxiety. Understanding what is affecting your vision is the first step toward gaining some peace of mind. One of the leading causes of vision loss in people over 65 is a condition called Age-Related Macular Degeneration, also known as AMD. To understand how AMD affects your vision, it helps to know how the eye works. Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, a light-sensitive tissue lining the back of the eye. The retina has two areas, the peripheral retina and the macula. The macula is a small area at the center of the retina. The peripheral retina is the large area surrounding the macula. It is the peripheral retina that gives us our side or wide-angle vision. It is the macula that gives us our pinpoint vision and allows us to see detail clearly, helping us to do things like drive, read, or recognize a face. Age-related macular degeneration, or AMD, is a breakdown of the macula. When the macula doesn't work properly, your central vision can be affected by blurriness, dark areas, or distortion. This condition affects many people as they get older. There are two forms of AMD. One is called atrophic or dry form. The other is called exudative or wet form. 9 out of 10 people who get AMD have the dry form. The retina is made up of many layers that are sandwiched together into a smooth surface. These layers work together, allowing us to see clearly. In people with dry AMD, the layer under the retina, known as the RPE, is affected by deposits called drusen, as well as other age-related changes. These changes may cause vision loss. A basic yet important tool for monitoring your vision is called an Amsler grid. You can use it at home to see if you have any changes in your central vision. You simply sit in a well-lit area and hold the grid away from you at a comfortable position. If you wear glasses, you should keep them on. Cover one eye and look directly at the point in the center of the grid. Pay attention to the pattern of lines in your side or peripheral vision. Then do the same with the other eye. Usually a vision problem from AMD makes some of the straight lines appear wavy or blurry. Some areas of the grid could look dark or even blank. If you notice any new changes in the grid, you should contact your ophthalmologist immediately. Noticing changes in the Amsler grid when you have dry AMD could be a sign that wet AMD is developing. With wet AMD, abnormal blood vessels begin to grow under the retinal layers behind the macula. These blood vessels leak fluid or bleed, which further blurs or distorts central vision. About 1 in 10 people with macular degeneration has the wet form. If your ophthalmologist thinks you have macular degeneration, he or she will run diagnostic tests to see what's going on with your macula. Depending on the form of AMD you have and other factors, your ophthalmologist will decide what the next steps are for preserving your sight. Early detection of AMD is critical to slowing down vision loss. In some cases, treatment might even improve vision. If you have any questions or concerns about your eyes or your vision, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.